And today we have Brittney, and Brittney, we're going to be giving you some injections both on the palate and the inferior alveolar, the lower teeth. And what I always like to do is make sure that my patients know about the new technology that we use that's going to make today's visit a lot easier, okay? If you hold this, you can feel it has some vibration characteristics. It's a lot like an electric toothbrush. Doesn't it feel kind of like that?
Yes, it does.
Okay. And the tip that has been individually wrapped, this is the actual part that's going to go in your mouth, and it just press fits on the end. And then when we actually go to give the injection, we're going to go ahead and what I like to do is I like to bend the needle a little bit, but we're going to start on your upper right, so if you just look straight ahead and open real big. There's a correct way to use this and an incorrect way. The correct way is to hold the actual disposable cone rather than just the motor. If you just hold the motor, you don't get enough control over where the vibration should be. By holding it in the cone area, I can actually establish a finger rest and get very good control. Then the tip is held flush, and if you notice there's a small bend in the stalk. If you don't have that, you're not applying enough pressure to the palatal gum tissue. Secondly, what's very important is this is incorrect if you have the tip not flush against the tissue. So Brittney, what we're going to do, does it kind of tickle?
Yes, it does tickle.
Okay. I want you to be very honest. We're going to go ahead and numb that first side.
Okay.
And then I'm going to give you a little numbing in the front and the upper left side. So open big again. So you're going to feel me pressing firmly against the gum tissue. I'm putting the needle in. And we're injecting just a small amount of anesthetic very slowly. And you can see that I've bent the needle a little bit on an angle so that it attacks the tissue at a 90-degree angle. There we go. And I always like to look at the patient's eyebrows at this point to see if they're sensing any pain. Okay, then we pull out, and if you notice, there's a small depression, a ring-like depression, and this is the actual needle injection site. We have now deposited anesthetic in the greater palatine foramen, and she should start getting numbness from the eye tooth back. Well, tell me a little bit. What do you think?
I didn't feel it.
Tell me the truth.
I didn't feel it at all.
Did you feel some vibration?
I felt it tickle.
A little bit of tickle. Good.
Tickle.
Okay, now we're going to go up to the front, and we're going to give an injection between the two front teeth on the inside. This is called a nasopalatine injection because of the spot in the mouth that it's in. Okay. So if you'll open real wide. And again, if you notice, I'm not touching the motor. I'm completely holding on to the conical area of the disposable tip. Again, it's applied firmly in the nasopalatine papilla. And if you notice, the needle's still at about a 40-45 degree angle. And the cone shape receiver of the disposable tip allows us to insert the needle in her nasopalatine foramen. And we inject. And look at her eyebrows. We're noticing she's just kind of calm. When we're finished with the injection, again, we have a circular pattern, almost like a donut type depression, and you can see where I actually injected into her palatal tissue. Okay, what do you think?
I didn't feel
Not
it.
bad. Have you had palatal injections before?
I have, and they sting.
Yeah, did you kind of wince or try to hang on to the chair? Or
They do sting, but I did not feel that at all.
Wonderful. Okay, well, we're going to proceed. Good, good, good. And I want you to tell the complete truth. We want your honest opinion on how this feels.
I would tell you.
I know, I figured you would. All right, and then we're going to go to the left side, and I'm going to turn your head a little toward me so I can see what I'm doing. And again, we now have orientation. If you notice, I'm still holding on to the conical portion of the disposable tip. And again, it's important to get a little bit of a bending of the stalk. And we're going to go ahead and slowly insert our needle into the palate and inject. And if you notice, this has got to be parallel and flush with the tissue. It cannot be this way or this way. As long as it's flush, you get the maximum effectiveness of the device. We're going to inject a little there. And again, when I come away, I know I've been successful as long as there's a depression of a ring and a little bit of blood in the center where the needle actually pierces the tissue.
Wow.
Isn't that cool?
It is cool.
What do you think?
I know it doesn't hurt.
It's a lot better.
So, yes, and that thing, it tickles. Accupal, it tickles.
Good, good. Okay, what we're going to do now is I'm going to put this up, and we're going to take this tip and remove it. I'm going to inject your lower teeth now. And for that procedure, we're going to use a different needle, and we're going to use a different tip. This pink tip is designed for injections on the bottom teeth, to numb the molars, for example. And again, it fits the same way as the one on the upper. The motor wand turns on, same vibration.
Okay.
Only this one is held a little bit differently.
Okay.
The device is held, again, not out by the motor, but on the actual conical disposable part of the device. The difference with the inferior alveolar is that instead of putting our thumb here to retract the tissue and have a chance of an accidental needle stick, we can actually take the tip of the inferior alveolar Accupal disposable tip, hold it into the fossa with decent pressure. This one you don't need to really bend the stalk, but if you notice what I'm doing, I'm just below the retromolar pad, and from the bicuspids on the contralateral side, we simply orient the needle to go into the tissue, and we're going to go ahead and inject. And then we aspirate. We pull out, we do the lingual nerve injection, and then we come out.
I did not feel anything.
Cool. Well, I'll
I
tell you
didn't feel
what.
anything.
Our final injection is going to be the inferior alveolar on this side. And again, the same orientation. I'm going to turn you just a little bit, and I'm going to still find that area. Again, that's in the retromolar pad area, in the triangular fossa. We orient the tip. The needle comes in from the contralateral side, and we go ahead and put our needle in, slowly inject, aspirate, re-inject, and then we're completed.